Good day, everyone. My name is Audrey, and I am here today to present the evolving case study about Miss Elaine Walters. So, what do we know about Miss Walters? Elaine is a 74-year-old female patient diagnosed with transient ischemic attack. Her past medical history includes hyperlipidemia, hypertension, ischemic heart disease, and type 2 diabetes mellitus. She needs assistance in ambulation and has episodes of confusion. She also lives alone and has no formal supports in place. With that, we now proceed to tackling the dynamics of the interdisciplinary team. Interdisciplinary teams is the collaboration among professionals from different fields with various expertise and knowledge to bring to the table. The interdependency of the roles within the team are vital in ensuring safe and high-quality patient care. These groups work together to address the multifaceted and complex needs of patients, utilizing effective communication, optimized resource utilization, and informed decision-making. These days, there's a higher demand for interdisciplinary teamwork due to several reasons. Firstly, the aging population has resulted in a higher number of frail elderly individuals and patients with complex needs related to chronic illnesses. Secondly, providing comprehensive care to patients require a greater complexity of skills and knowledge. Lastly, increasing specialization within health professions has led to fragmentation of disciplinary knowledge, making it impossible for a single healthcare professional to meet all the complex needs of the patients. Now we go a bit more in depth by discussing two key players involved in the care of Miss Elaine. Trained in providing support to individuals, families, groups, and communities, social workers aim to improve the well-being and help people overcome personal difficulties and structural barriers. They empower people to harness their strengths and potential, providing guidance and support to those struggling with mental health issues or in need of counseling. Additionally, social workers may refer individuals to other healthcare organizations or relevant healthcare professionals. Occupational therapists, on the other hand, help individuals overcome various challenges so they can lead independent lives. Whether it's due to illness, mental health issues, developmental delays, or the natural effects of aging. When an adult or elderly person is impacted by an illness, they may utilize a range of techniques and strategies to aid in the development of new skills for daily living. Additionally, they can help individuals adapt to their circumstances by providing modifications to their home environment, equipment, or other resources. Moving along, we now introduce the collaborator, communicator, and the coordinator of the healthcare team. So what exactly is the role of the registered nurse? Because nurses have a unique relationship with patients, function as patient advocates, and in Elaine's case, provide care 24/7, they are known to be the coordinators of the interdisciplinary team. An example of the nurse's importance in the interdisciplinary team in action is seen when it comes to catering to patients with ambulatory issues like Elaine, and how she carries out something as simple as her hygiene measures. The nurses are able to assess how much assistance they need in carrying out these ADLs. The information is vital for other healthcare professionals in developing Elaine's plan. Similarly, when dealing with elderly patients who may or may not be confused, it's not enough to just conduct an interview with them. In this case, the nurse's observations, provided that this is properly documented, can prove invaluable. Furthermore, nurses wear a lot of hats depending on a multitude of factors. Being the largest group of healthcare providers, they bring a wealth of expertise and patient knowledge to the table. Gone are the days when the sole responsibility of a nurse was to provide direct nursing care in the traditional sense. Although this is also the very role that gives leeway to the modern and collaborative roles that nurses have to date. The scenario shows that a thorough handover is key to the continuity of care. The nurse should take into mind that patient care does not end when her shift does, and should see to it that the same level of care is delivered even after she leaves the workplace. RN receiving the handover should respectfully ask for the missing information, investigate the situation further, and reinforce thorough documentation. Also worth noting that the degree of autonomy the nurse experiences is directly related to the patient's needs, their level of expertise, and the practice setting. For most part, nurses deliver care in complex and dynamic circumstances in collaboration with health and social service providers, as well as with family members and caregivers. For us to have a deeper understanding of just how clear communication is in the profession, we need to give it a proper definition in the nursing sense. Effective communication is an essential component of interpersonal interactions. It encompasses the ability to articulate one's knowledge, thoughts, and opinions with the aim of exchanging ideas and constructing shared meaning. In the professional world, effective communication is a critical skill, and this holds true for the nursing profession as well. As a nurse, one must be adept at communicating with patients, colleagues, and other healthcare professionals to achieve optimal outcomes. In this context, nurses need to focus on interpersonal communication, which involve exchanging health-related information, forming a therapeutic relationship with the patient, and developing collaborative relationships in the interdisciplinary team. To achieve these goals, nurses should possess an understanding of healthcare matters while giving the patient's needs and interests the utmost priority. Circling back to Elaine's situation, effective communication and teamwork play a vital role in ensuring high-quality care. RNs must assertively communicate to the healthcare team, be it her fellow nurse or, let's say, Elaine's occupational therapist. This is done to avoid communication breakdowns that can result in adverse events for Elaine. Thus, it is essential for nurses to be proactive and vigilant when it comes to communication to ensure that all team members are on the same page and that patients receive optimal care. We now reflect on my learnings using the Rolf, Freshwater, and Jasper framework. In my capacity as a future registered nurse, I am thoroughly convinced that the insights gleaned from this case study are pivotal in laying a firm groundwork for my professional career. Although academic knowledge is undoubtedly invaluable, it constitutes merely a single facet of the overall picture. To excel as a nurse, one must adopt an evidence-based approach, engage in periodic self-reflection, such as I'm doing now, and cultivate an array of interpersonal skills. Furthermore, effective communication is an essential component of furnishing comprehensive care and advocating for one's patients. Indeed, surmounting a variety of obstacles is requisite for delivering the highest caliber of care and attaining personal fulfillment within the profession. So having practiced as a nurse in my home country before, I am highly aware of the significance of communication in my line of work. Having said this, I saw the need to unlearn previous communication patterns I have accumulated throughout my personal and professional life. Furthermore, while it is essential to possess sound clinical knowledge and skills, it is equally vital to cultivate good interpersonal skills and engage in therapeutic communication practices within the workplace. This will enable me to interact effectively with other members of the healthcare team and effectively leverage their expertise to achieve the best possible outcomes for my patients. As a student nurse, it is incumbent upon me to have a comprehensive understanding of the roles and responsibilities of all team members in the Australian setting to ensure seamless coordination and delivery of high-quality care. As nurses, we join the profession because of a strong passion for enhancing patient care and advocating for patients. However, it is important to make arguments backed up by data and strong rationale rather than relying solely on aspirations. To improve my communication skills, I plan to reflect on my personal style and seek feedback from my preceptors and colleagues during placements. Additionally, I will develop strategies to improve interactions with the disciplinary team. More specifically, building confidence in communicating or questioning those in authority respectfully and collegially. So in conclusion, Collaborative commitment from professionals of diverse backgrounds is crucial for providing quality patient care. To achieve our shared objective, the interdisciplinary team must work efficiently and effectively, taking into account the complex healthcare challenges that we encounter on a global scale today. Thank you for listening.